How to count ribs, a step-by-step guide. 1. Begin at the jugular notch start by palpating the jugular notch, the prominent depression at the superior border of the manubrium of the sternum. 2. Locate the sternal angle. Gently move your fingers downward along the midline of the sternum until you feel a noticeable ridge. This is the sternal angle, also referred to as the angle of Louis. It represents the junction between the manubrium and the body of the sternum. 3. Identify rib 2. At the sternal angle, the costal cartilage of rib 2 articulates with the sternum. This makes rib 2 your first palpable rib, serving as a reference point for further counting. Count ribs sequentially. From rib 2, proceed to count the ribs in a downward and lateral direction along the chest wall. Each rib can be identified by following its course from the anterior sternum towards the lateral thoracic wall. Key considerations in clinical practice. Variations in nipple positioning. In men, the nipple is generally located in the fourth intercostal space, providing an additional point of reference. In women, the relationship between the nipple and intercostal spaces is less consistent, as breast size and asymmetry may alter its positioning. Visualizing the margins of the heart. The heart's outline can be appreciated by correlating specific surface landmarks. 1. Upper limit. The superior boundary of the heart lies. Right side, at the level of the third costal cartilage adjacent to the right border of the sternum. Left side, in the second intercostal space, just lateral to the sternum, right margin. This boundary extends vertically from the right third costal cartilage down to the right sixth costal cartilage, outlining the right atrium. Second, left margin. On the left side, the margin slopes laterally, descending from the second intercostal space toward the apex of the heart, located near the midclavicular line within the fifth intercostal space. This margin primarily corresponds to the left ventricle. 3. Lower margin. The inferior border of the heart stretches from the sternal end of the right sixth costal cartilage diagonally to the apex in the fifth intercostal space near the midclavicular line. This region is formed predominantly by the right ventricle. Where to listen for heart sounds. The tricuspid valve. The tricuspid valve is best heard at the lower part of the sternum, just to the left, around the fifth intercostal space. This area reflects the flow of blood through the right atrioventricular valve, second mitral valve. For auscultating the mitral valve, position the stethoscope at the apex of the heart, located at the left fifth intercostal space along the midclavicular line. This region corresponds to the left atrioventricular valve, which is typically louder in the lateral left chest. Third pulmonary valve. The pulmonary valve can be detected at the medial end of the left second intercostal space, which marks the location where the right ventricle ejects blood into the pulmonary artery. Fourth aortic valve. Finally, the aortic valve is auscultated at the medial end of the right second intercostal space, situated at the site where the left ventricle pumps blood into the aorta. Auscultation of lung sounds. 1. The right lung auscultation. 1. Apex of the right lung. Place the stethoscope just above the clavicle on the right side. This position helps assess clear breath sounds from the lung apex, which is vital for evaluating upper airway function and detecting signs of restricted airflow. 2. The superior lobe of the right lung. Position the stethoscope on the anterior chest, immediately below the clavicle. Ensure the sounds are symmetric and free from wheezes, crackles, or abnormal noises, which could indicate issues like infection or fluid retention. Third middle lobe of the right lung. For optimal assessment, place the stethoscope laterally around the fourth or fifth intercostal space on the right side. This will allow you to evaluate airflow in the middle lobe and detect potential blockages, consolidation, or abnormal breath sounds. Fourth inferior lobe of the right lung. Move the stethoscope to the lower posterior thorax near the base of the lung. Deep breath sounds here are crucial for assessing the lower lobe's function, helping to identify any signs of atelectasis, fluid buildup, or diminished airflow. Second left lung. Auscultation 1. The apex of the left lung. Position the stethoscope just above the left clavicle. This location allows you to compare the left lung's apex with the right. 2. The superior lobe of the left lung. Place the stethoscope just below the left clavicle on the chest. Ensure the sounds are symmetric and clear, with no signs of wheezing, crackles, or other irregularities that might point to pulmonary issues. Inferior lobe of the left lung. Position the stethoscope on the lower back near the rib cage's base on the left side. This ensures thorough evaluation of deep breath sounds, which can reveal signs of fluid accumulation, lung consolidation, or obstructive conditions.